When I think about Big Cities Health Coalition, I think about people who just get it. They get that we often need to move very quickly. They get that often the way public health issues show up in big cities is different than how they show up in more suburban or rural areas. And they get that we have to share resources.
It is such a great group with a huge wealth of knowledge and experience, and it's so helpful to be able to freely discuss some of the things that we're all going through and bounce around ideas of how to solve some of our common issues.
I had been looking for some time for ways to connect with other agencies that were approaching their work from an urban health perspective, that were grappling with some of the same issues that my community was facing. And the Big City Health Coalition really brought together colleagues and cities and an approach that filled that need.
Being able to discuss with other public health leaders different approaches for addressing pressing issues was invaluable. Throughout the pandemic, I have marveled at and been grateful for all the coalition and you have done to keep our big cities safe and healthy.
The Big Cities Health Coalition brought together public health leaders from across the country to brainstorm on policy ideas, pressure test systems changes, to coordinate efforts to improve the health and well-being of millions of people across the country. I am forever grateful for the connections I've gained through my engagement with the Big Cities Health Coalition, and I am really excited for the next chapter of the coalition.
So being a part of Big Cities Health Coalition, the department has had the advantage of being able to get real-time information from our peer cities to find out how they did things, the successes of their interventions and their public health programs.
Being part of this network and the professional relationships and friendships that I was able to develop, and being able to have a forum and a space that Chrissy and the team creates where we feel comfortable picking up the phone and not only calling her directly, but other partners is something that I definitely valued.
We learn from each other in each conversation. We have frank conversations we don't have an opportunity to have anywhere else. We exist in shared experiences, and we get some good laughs in as well. In addition to all of this, I've learned and admired the strength, the powerful stands, the immense strategic thinking, and strong commitment to public health and the people they serve. Big City Health Directors are truly an awesome group, and it's a privilege to serve with them.
It was really valuable for me to learn about different leadership styles, different ways people were solving problems. I learned a tremendous amount, and I always found it a lot of fun to get together in person and get to know folks.
I learned that I was not alone as a professional heading a big city health department. The challenges were not necessarily insurmountable. The reality is that we're all on a public health improvement journey, and we just have to take it a step at a time if we're going to be successful.
We as a local health department have an opportunity to work closely, collaboratively with other health departments from across the country and are able to support each other and collaborate to really make health equally attainable for everyone in our country. One of the great things about Big City Health Coalition is we get to exchange ideas, we get to talk on a regular basis, and get a chance to actually be able to have support as a local health department director.
I know our health department is better because of this opportunity to learn from others, and I'm truly thankful to be part of BCHC.
Thank you so much to Big Cities Health Coalition for the last 20 years, and thanks to all of you for the late night support. We know how to move fast, we know how to move together, and we know how important it is to get the voice of big cities out there for the public.